Managing a serious illness can be complicated and confusing. And if you're a caregiver, you see firsthand how difficult daily living can become, both physically and mentally. Today, I have Dr. William Logan, National Medical Director, Carelon. Am I saying that right too, Doctor? Carelon
Yes,
Health.
sir.
Okay. So, Dr. Logan, the first question is, what is palliative care?
Well, James, first of all, thank you for having me. Palliative care is a medical specialty, just like cardiology or neurology, except palliative care is really focused simply on the relief of suffering. And that can be suffering that occurs as a part of a disease process, the treatment of that disease, or the confusing healthcare system that people have to work with during an illness.
So, why choose palliative care and when?
So, a lot of people, James, associate palliative care with hospice. And hospice is palliative care, but it's palliative care that occurs at the end of life and is focused on those end of life needs. So all of hospice care is palliative care, but palliative care is so much broader than just hospice. Palliative care can be applied anywhere along the illness journey, and many of the patients that Carolina Health Palliative Care provides support for, many of those patients are cured of their illness and go off of our service at some point. But with palliative care services, they receive a wraparound support for them and their caregivers in the midst of serious illness. So it can be an absolutely beautiful help in the context of almost any serious illness.
So, how is palliative care different from hospice care?
Well, as I said, hospice really is only end of life care. In order for a person to move into hospice care, they really have to have both the certification of their physician, and then they also have to be willing to make that decision that if the disease that they have carries out its usual course, that they have about 6 months to live. So that truly is end of life care. Palliative care can be applied at any time during any illness journey. So we come aboard and come alongside primary caregivers and primary specialists in many different disease processes, whether they're diseases that involve infections, the nervous system, the heart and lungs, any parts of the body that can become seriously ill. A palliative care provider can come alongside your regular provider while you're receiving curative treatment and provide that supportive care.
Now, what is advanced care planning?
Super question. Advanced care planning is a special deep discussion between you and your trusted health advisor that allows the patient to really state what they would and wouldn't want from or during their healthcare journey. So, would they want specific supports like tube feeding or resuscitation with a ventilator or other specific desires? And they document those, and those specific desires go down on paper. And then, if that patient were to lose their voice at some point along the healthcare journey, that advanced care plan informs both the healthcare providers and it informs their caregivers and loved ones so that their voice is heard even if they lose their speaking voice during that healthcare journey. So they're still in charge of that journey. They're still the ones directing the care as they go through.
Now, how does palliative care help caregivers?
Oh, that's a really great question. As anyone knows who has walked with a loved one through a serious illness journey, when that loved one, when the patient is suffering, the caregivers suffer right alongside them. So when the patient receives palliative care, the caregivers also receive support from palliative care. Palliative care providers incorporate the caregivers into the care that they provide for the patient so that the all important caregivers have the emotional and physical strength to walk with that patient through that serious illness journey. It's a really important piece of support for folks who are in that process.
If you don't mind me asking this question, Dr. Logan, I'm sitting here and thinking about that. What does that patient go through mentally and emotionally during this time?
Boy, the emotions can run the gamut, James, and it depends on a lot on kind of what their understanding is of the disease process. It depends on what their family has suffered before, what they have experienced in the past, and quite frankly, James, it can also really depend a lot on the degree of information, education, and support that they're getting from the healthcare system. One of the most difficult things in the midst of a serious illness journey is not knowing, and that causes fear. And palliative care is particularly good at recognizing when people have fear and getting at the sources of those fear and really helping that patient and their caregivers overcome those fears through good planning. And when there's good planning and there's knowledge in place, those fears are relieved, there's more peace, and the quality of life is much higher.
It sounds like I would have a lot of fears if I didn't understand what was going on. A lot of fears, definitely.
Absolutely.
Been speaking with Dr. William Logan, National Medical Director, Carelon Health. Thank you so much for joining us on Morning Blend. We really appreciate your time.
James, thank you so much for having me.